Can you hear me, Paige?
I can.
Okay, thanks.
Hello, everyone.
Morning.
Good morning.
Good morning.
Good morning. Ms. Jernan, do we have a quorum?
Not yet, sir. We're waiting on Miss Mood.
Thank you.
Good morning, Miss Mood. We have a quorum.
Morning, Paige. How are you?
I'm good, thank you.
Okay, I'm gonna call a meeting to order. It's been established we have a quorum. Motion to adopt the agenda, please.
I so move.
I second. All in favor, aye.
Aye.
Very good, aye. Next item, discussion of action items. Mr. Ando, Mr. Deschamps, Mr. Bell, please proceed, Mr. Ando.
Yes, Mr. Chairman, I will ask Mr. DeChamps to start with item A.
Okay, thank you. Just an update on the executive order. The governor did issue another state of emergency, extending it for another 15 days. So we're still operating under that state of emergency. And also with the new administration, President Biden issued an executive order on January 21st requiring masks on all public transit vehicles. And in following from that date, you also had CDC that issued the order requiring that of riders. And also to the TSA issued a security directive to implement these requirements. With that being said, what we did from there is we sent a message just reinforcing out to our ridership, our requirements, and making sure that we're constantly having not our riders only, but also our operators reinforce that, making sure that they are wearing masks also. So we did communicate that message out to our ridership and also staff. As you know, the City of Columbia, their council, they did extend the mask ordinance for another 61 days, basically bringing it to April 1st. But also to other jurisdictions we have listed here, they've extended, or if they didn't extend it, they're still current where they're requiring masks. So all of those jurisdictions are listed in your packet. And that's where we are on the executive orders. And we can go on to B. Okay, Joe, I think you're there.
Good morning. Good morning, Mr. Chair.
Morning.
Ms. Mood. Okay, operational update. So far, we've had no situations regarding passengers refusing to wear their mask. A lot of the riders have been more cooperative. Little pushback when they're wearing their mask underneath the bridge of their nose. However, that only lasts about like 5 minutes. Once the rider sees that the operator's not moving the vehicle, they move forward to cover their full face and board the vehicle. We had Lovelace here to do some testing, an update on administrative operations and maintenance personnel and TCS from the beginning of the testing. So far to date, 194 total tests have been conducted for admin, operations, maintenance, and TCS personnel. That's 10 admin, 123 operations, 9 maintenance personnel, and 52 TCS personnel have have received tests. So far, I think we've had just 2 instances where individuals have tested positive. One was sent home. It was an operator. We took precautionary measures, got the building fogged and disinfected, deep cleaned. We sort of did our internal contact tracing steps, finding out who was in contact with the individuals and, advise them to get tested as well. So the ones that we advised to get tested came back negative. Everyone was quarantined and retested, came back to work with a negative test result. So That is pretty good. We're trying to keep our bubble clean and safe for everybody that enters the building. Maintenance has been diligent in taking their temperatures since we have the thermal scanner back there in the shop. We keep having to speak with visitors, coming in, but nicely and politely, just ask them to take their temperatures. And if they're going upstairs, we advise them once they exit the elevator that a temperature scanner is in front of the elevator, so to please check their temperatures upstairs if they bypass the one downstairs. Food service deliveries. We have 57 food service deliveries for the month of January. That's 33 less food service deliveries from December, which was 90. Again, the drop is due to programs loosening up their schedules. But we're thinking based on the most recent events, and now that we have this variant of the COVID strain floating around, I'm sure food service deliveries will go up due to the fear of contracting that new variant. Service detailings and foggings and interior exterior cleanings of the buses for the month of January. 342 detailings were performed for the month. 400 foggings were performed, and 1,206 interior and exterior cleanings were performed for the month of January.
Joe.
Any questions? Yeah, any
Joe,
questions?
I apologize. What was the last number? 1,206?
Yes, ma'am.
Okay, thank you.
You're welcome, Paige.
And while we have a pause, Joe, may I ask a question? Remind me of how, did we just get the referrals from Senior Resources of who we deliver meals to? Do those just come to us from them and then we follow through? Is that how that process works?
That is correct. The communication is with TCS, their supervisor, their interim ops manager, and their staff communicated, emailed the list, and those folks are entered into the system and vehicles are dispatched.
Right. So Leroy, I guess I was just making sure that we don't really have any responsibility for outreach to kind of market that service that's available. We are just responding in terms of our contract with Senior Resources and the marketing part, or how they get the word to people, is in their hands. Is that right, Leroy?
Yes, as they, through whatever avenue, as far as them contacting us, we coordinate where I think there, and maybe I think if Pam's on the line too, she can speak to it, where if we see an opportunity for us to promote or with them during that partnership, we do try to do that.
Okay. So we can be open and let people know about that, or people hear word of mouth, but we don't really have to have a structured program to promote that.
Yes.
Okay, I got it. Thank you.
Joe, does that conclude your update?
Yes, that is it. Just any questions, let me know.
Okay.
Thank you.
Okay.
You're
If no updates, this is Leroy again. Just an update on testing. Through our partnership with DHEC, we're still offering testing at Comet Central. There's a kiosk there that we utilize for that testing. The dates are still Wednesday through Friday, time 7 a.m. to noon, and then from 2 p.m. to 6 p.m. And then on Saturdays from 10 a.m. to 5 p.m. Also, too, this past week, we did have Lovelace in to do testing with staff. The next scheduled date for testing with the staff would be March 2nd and March 3rd. Right now, that's the last scheduled dates as far as testing with staff. Uh, and just wanted to mention to I guess the subcommittee, I can, and I've been sort of talking with them as far as maybe offering testing in April, May. And one reason I was looking at that is because if we look at phase B and not knowing specifically when it may start and how it will and when it will apply to like the transit industry, I thought maybe we should go ahead and schedule maybe another April, May to offer that to staff here at the administrative building, even though we have the testing that could be utilized at Comet Central and also all the different locations throughout the, the area. I thought it would still be good for us to kind of maintain focus on that by continuing to offer testing here.
Mr. Chairman, I don't know if we need to do anything other than just, I would just say, I think that's an appropriate, prudent kind of thing to have on the calendar. And then
I concur. I concur.
Okay, thank you. And I'll work with them to get the additional dates, April, May, on the calendar.
Thank you.
All righty, thank you all. And also too, that concludes it unless there are other questions about testing. And if
Next item, please.
D, is Ron on? Or Joe, will you give that update?
Give me 1 second. Which update, Leroy? I'm sorry.
The update on the driver barriers and use of far UV technology on buses in the building?
That UV installation on the one unit, correct?
Right. And also if you've got the update on the driver barriers.
One second. Hey, Leroy, give me 1 second. I got Ronnie trying to dial in, but give me 1 second. He's having a hard time.
Can we go to the next item, please, and come
Yes,
back?
please.
Yes, sir. Okay. We can move on to update on the DART office space. Tanisha.
Good morning. As we
morning.
continue, good morning. The mask policy is still being enforced for the employees of the paratransit office, customer experience reservationists, and the dispatchers. All workers are continuing to wear their mask, and the area is still being deep cleaned and fogged weekly to include the whole building. And we're also minimizing the interactions to prevent any outbreaks. We still stagger the schedules, and they're still exercising social distances. And a couple more people have elected to wear the mask. I think you would call it the inserts or the shields in between the mask. It does help them to speak clearly and be able to breathe a little better while they're on the phone. And that's my update.
Thank you.
Okay. And if we're still waiting on Ron, we can go ahead to F, update on vaccination and impacts to public transportation or public transit. I'm sorry, John.
Yes, members of the committee. Phase 1B has been pushed to early spring of 2021. Pfizer and Moderna vaccines are available in South Carolina. They have since lowered phase 1A to 65 from 70 to allow seniors to get access to the vaccination. Page 7 of your packet gives you just information on the vaccine allocations between Pfizer and Moderna. And it appears that CVS and Walgreens are also holding vaccinating clinics to help people get access to the vaccine. And we can still continue to work with DHEC on implementation of a registration program at Comet Central. And in this case, we would use our customer experience representatives who would help those that don't have access to a computer register. Our customer experience team is evaluating how that can work and how long it would take to serve each customer at our window. That's all I have on F, if there are any questions.
All right, so John, you talking about registering for an appointment for the vaccine?
That's correct.
Okay. Mm-hmm. So we're assisting people who come and ask us that.
Not yet. We're evaluating how we can incorporate it into our staff to be able to do that at our customer experience window. Hopefully we'll have resolution on that next week so we can get that going.
Thank you. I know it takes some time because there's a lot of numbers out there, but I do appreciate your efforts thus far and working as expedient as possible. Thank you. Next item, please.
Okay.
Hey, Leroy, members. I got Ron Sweeney on the line to discuss the barriers and the UV installation. If you guys are ready.
Yes.
Please proceed.
Good morning, everybody.
Morning.
I'm happy to report that on February the 23rd, the New Flyer people will be in here to finish installing the barriers, the driver barriers in all the New Flyer buses. And also New Flyer, once that gets done on the 23rd, that'll be complete the barriers in all the buses except the 2 trolleys. And then the New Flyer is their engineering department is engineering the 2 for the trolleys currently. So that'll be great to get those majority of the installs done on the 23rd, and then when we get those 2 trolleys, that'll complete that project. The far ultraviolet light that we installed in bus 802, I checked the installation and it looks like it was a good installation, and we've sort of kind of put it back on the manufacturer to kind of let us know what kind of means of testing we could do to see how effective the light is. So we're waiting to hear back from them on that. But that's where we're at with the ultraviolet light for technology and the driver barriers.
Any questions for Mr. Ron?
Really, Derek, my question probably is more to John in terms of the timing of completing the installation and how that's related to the timing of reintroducing fares, because what I'm realizing is that the reintroducing fares is a financial item, but it also changes our whole process for customer boarding and stuff. So could you just speak to that a little bit, John, about how that will work?
How the I'm sorry, can you repeat that last part?
Yeah. I was just trying to think through that with the completion of the installation of the barriers, I know that that's tied to when we reinstitute fares, and I realize that when we do that changes a lot of the processes for our customers, in terms of boarding. And yes. So I just I was just asking sort of where we are with that.
Basically, once all the barriers are done, a finance committee will be discussing the collection of fares, and okay. We're preparing ourselves if finance says they want to reinstitute fares or recommend to the board to reinstitute fares, to make sure we have all the processes in place so that we notify the customers that fares will be resuming on X day, and we have like the armored truck and appropriate passes so that we can institute fares, and then we'll have a public information campaign as well.
Oh, good. I just really wanted that reassurance that didn't just automatically happen, and so
no, it just wouldn't be an overnight thing.
Good. Thank you.
And John.
Yes, sir.
I think two-part of that question is, once we do institute fairs, how do you proceed the boarding and offboarding and all that to work?
It would resume pre-pandemic, so passengers will board through the front doors and exit through the rear doors. For those that are wanting vaccination, they would show some proof of an appointment to go to that vaccination.
Okay, very good. Next item.
Leroy, you're on mute.
Sorry. Next, we'll have item G, Don't Miss Your Shot Transportation Program by Miss Bino Reed.
Thank you, Leroy. Good morning, members of the committee. So yesterday, we launched our Don't Miss Your Shot transportation campaign. We got excellent media coverage of the kickoff. The major networks have asked for continuing stories, so I'm working with WIS. They want to do an ongoing story, and WLTX did a comprehensive piece on us that was online as well as on regular broadcasts. Our website, Comment COVID Help, launched, and it's also connected to our site, and it has all of the information, including links to DHEC on how to find out if it's your turn, and then the second part is how to find where the vaccines are. And then we have information there that talks about this is how we can take you there. We have everything from fixed routes listed to DART to VTRIP and PUP programs. Flyers, brochures, and posters were designed, and we do have a limited quantity right now, but I'm in process of getting bids to print approximately 50,000 pieces to get out in the community, and these will be distributed to beauty shops, barber shops, churches, really just saturating the community, and we'll be helped by Thomas Media Group, which oversees Black Pages and Black Expo. We'll also have distribution of these collateral materials or marketing materials to our partners who attended yesterday. Prisma Health, Lexington Medical Center, Columbia VA Hospital Senior Resources, Columbia Housing Authority, as well as DHEC has asked for some of those as well. We have additional partners coming online. I had a meeting with Cooperative Health, which some of you remember was the health clinic started by Stuart Hamilton. And they are, it's about 28 of those in Richland and Lexington counties in underserved communities. So we'll be partnering with them as well to get the word out about this program.
Would you say that name again, please, Pam?
Which one? Cooperative Health?
Cooperative Health?
Yes, ma'am.
Okay.
And Ms. Bino Reed, would you please send members of the board, the entire board, copies of the HART materials, their mailing address, please?
To their mailing address?
Yes.
Their physical mailing address? Okay.
Yeah, hard copies, please.
Okay.
And Mr. Chairman, I just want to say again out loud what I've said in messages, and that was how impressive it was to see yesterday both the results of all the efforts the staff has made to develop this initiative and the amazing kind of community partnership response that we've gotten. I mean, it was really heartwarming to see that concerted effort across so many entities, and I'm proud of our doing that, and I'm giving you credit, Derek, for this for the vision to get us on this task very early.
Well, I must commend Ms. Bino Reed, because she's been doing the heavy lift. I know everyone worked to do this, get this done, but Ms. Reed did. And Ms. Jernigan, please let the minutes reflect the chairman wants to commend Ms. Bino Reed for her hard work and her long hour work to pull those off.
Yes, sir.
All right, now, Mr. Chairman, I do have one question about this because because Pam said that the media is interested in this as an ongoing story, which I am so delighted, because this is not a one-shot deal, no pun intended. It's something that we have to keep before the public for a while, and so I'm so glad they're interested in doing that. And really, my question is that to be sure that our internal processes help that go smoothly, because I know we had a little disruption in the past about media contacts, and so is Mr. Bell on the line?
No.
Not. Well, here's what I just want to be sure of, is that things go smoothly. And here's how I understand our process to work. That if Pam gets a call from a media source saying, we want to come film, we want to interview frontline staff about this, that if that interview of frontline staff is a contract employee, that she goes to Mr. Bell and says, who is it that this is what the media is asking, who can they have access to do this? And it's his choice who they interview, but then that his identifying that person is all that's necessary, because I'm aware that RapDev has a corporate marketing structure, but I also know that when you get a call from a reporter, you don't have time for a process. You've got to have a response, because they are all working on a deadline for either the publishing or the next broadcast. And so I just want to be sure our internal process is operating smoothly, so that we don't run into any hiccups in being able to use the media to get our message out.
Point well noted. Ms. Bono Reed, that concludes your report?
I did want to add one thing that I omitted. Today, we're recording the radio spots for the campaign, and we will begin on the television spots shortly after that. The TV is going to be done in 2 phases. In order to be cost effective and get things done quickly, we're going to create a television spot based upon the footage that we already have, and combine that messaging. We're working on the script for that now. And then phase 2 of our television spot would be, we'll have a lot of testimonials of people who have utilized the Comet to get their vaccine, and it will give a snapshot of the story of this particular program.
Very good. Mr. Ratio, do you have anything to add? Any other discussion?
But Mr. Chairman, I don't want to belabor my point, but I just want to check with Leroy. Will you may have already done this, but will you just affirm with Mr. Bell that the process I described for access to staff for media requests, that is in place, and that he's the final voice on that, so that all we need to do is contact him and we're okay?
Ms. Moot? Yeah, I got Maurice Bell here. He can respond to that.
Oh, good. Mr. Bell, how are you this morning?
Pretty good. How are you? I heard everything.
The question I was asking, and you may already be tuned into this, but the question I was asking was, recognizing that what Pam is saying about the media's own interest in our vaccine initiative as an ongoing process, when she gets a call from a reporter, I know there's a very short timeline. I mean, they are looking at a deadline. And so my understanding is that she contacts you about who is available in our contract staff to be available to the reporter, and that once you make that assignment, it's okay to go ahead. Is that how that?
Yes, I heard you. I was here when you were originally talking about it.
Oh, I'm sorry. I apologize for going back over all that.
That's okay. It's okay. I fully understand. I was here in Joe's office for the whole call. So, but yes, we will make sure if she contacts me. I will make sure that there's a response provided timely.
Very good.
Because I've been on that end of getting those reporters calls in previous work, and they don't give you so much time. So a lot of the time. So I appreciate that.
And excuse me, Ms. Mood, what I can also do is I can reach out to my counterparts in marketing and at RTP Dev to let them know about this campaign, to kind of get some pre-approval a bit and let them know that things may be coming with very, very short notice to help expedite that process and work with Maurice on that as well.
And please
that
keep
sounds good to me. Does that sound appropriate to you, Mr. Bell?
Yes, I will check.
I'm really asking about the RapDev internal protocols in terms of does that sound reasonable to you for Pam to make that contact with the RapDev marketing?
Let me refer back to RTP Dev, and then I'll come back around and make sure that we have the formal process, because I definitely don't want to be stepping on any toes under the circumstances or doing any additional unnecessary communication if there's already a process that's in place. So we'll come back around and have a response for the next meeting.
That is great. So I'm understanding that you're going to contact the RapDev marketing and alert them to this campaign and give them Pam's number so that they can initiate a conversation if they need to have that.
But excuse me, Ms. Mood, the thing that I'm trying to communicate is that I already am in contact with the RTP Dev marketing department. And
okay.
Yeah. So I can.
Okay, well, just keep Mr. Bell in the loop, please. That's the point. That's the point. Fair.
Sure.
That's just keep Mr. Bell in the loop, so he'll know, he's fully aware of what's going on in his organization, so he can be in a situation where he's empowered to help us get this moving also. So that being said,
I think what Mr. Bell said is exactly what I'm aiming for. Is I don't want us to unintentionally step on any toes that we can prevent that.
Thank you. All right, that concludes everyone's report. I just want to commend staff for and all staff for giving us a thorough report. Motion to adjourn.
I'm so moved.
I second. All in favor, aye.
Aye.
Good afternoon, everyone.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.